You're listening to Therachronicles with Dr. Rosy and Dr. Krish. This health awareness series is brought to you by Therachron, tailoring therapy.
Hey, hello. I'm Dr. Rosy.
Hi, I'm Dr. Krish. We welcome you to the very first episode of Season 1 of Therachronicles.
And today, we are going to talk about diabetes.
Hey, Rosie. So, before we begin our discussion for today, I just wanted to take a moment and ask you, what impact has diabetes made in your life? Do you have any close friend or family, or say the story of a patient of yours who was seriously affected by it?
Well, Krish, let me tell you, it is extremely difficult to pinpoint one particular patient story.
Yes, right. We come across so many of them in our everyday lives.
Exactly. Now, during my practice, I have attended numerous such patients who have reported to my office with visual loss, primarily due to uncontrolled diabetes. Now, many of them could be treated successfully and they could regain their older vision. But some, unfortunately, lost their sight permanently to diabetes. Now, what makes me feel bad as a clinician is that they would have probably never had lost their eyesight if they were diagnosed and treated for diabetes on time.
Yes, that is very often the case. I remember my uncle, who used to be so vibrant and such a workaholic in his younger days, and unfortunately, because he was non-compliant with his diabetes medicines, he landed up with poor eyesight, dialysis, and now he's bedridden. Last time when I met him, it was very saddening to see the consequences of the disease.
Actually, that's the kind of toll that diabetes takes on people we know. And that's indeed very sad. Well, now before we start with our discussion, Krish, could you give a simple explanation of diabetes for people who are listening to us?
Yes, sure. So diabetes mellitus is defined as a chronic disease that affects our body's metabolism and is characterized by an increase of blood glucose or blood sugar levels.
Now one might say, how does it concern me if my blood sugar levels are high? I just have sweet blood, or I just had too many chocolates, or maybe I just had a meal.
And that's where we have insulin coming into the picture. So insulin is a hormone which is produced by an organ in our body called the pancreas. Now insulin is responsible to reduce the blood sugar or blood glucose levels. And how does it do it? By sending this sugar from the blood to the cells in the body.
Yes, this is precisely the reason why reduced amount of insulin or cells' inability to detect insulin leads to raised blood sugar, which is also known as hyperglycemia. Now, this eventually causes serious damage to many of our body's vital organs and organ systems.
Great. So now that we have spoken about what diabetes is, Rosie, what do you think? We should tell them about the types of diabetes?
Sure, absolutely.
So broadly speaking, we have 4 categories of diabetes mellitus, and it is based upon how it is caused. I would suggest let's talk about type 2 diabetes first, considering it is more common than the other types. What do you think?
Okay, so let's get on with that. So type 2 diabetes is also called adult onset or non-insulin dependent diabetes mellitus. I know it might sound a bit tricky, but it just means that human cells are unable to respond to insulin. Now, this accounts for more than 85% of the diabetes cases globally. It is usually caused due to excess body weight and sedentary lifestyle. Now, if you are talking about the symptoms of this disease, then this would include excessive passage of urine, increased thirst, constant hunger, increased body weight, visual changes, and yes, fatigue.
Well, before we get back to more technical facts on diabetes, let me share something interesting for our listeners. As you rightly pointed out, one of the symptoms of diabetes is excessive passage of urine, right? So now the disease derives its name from there. It's very interesting. The word diabetes is Greek for siphon, which refers to the huge amount of urine, and mellitus means sweet. So the word diabetes mellitus literally means huge amount of sweet urine.
Well, Krish, this was an interesting quick fact. And thank you for sharing it with us.
Yeah.
So, getting back to type 2 diabetes, what is most alarming in this disease is that symptoms are often less obvious, which means that this disease may be diagnosed years after the onset or only after it has become complicated. Now, another concern is that until recently, type 2 diabetes was seen only in adults, but now there has been an increase in the number of cases of children suffering from type 2 diabetes.
Absolutely right. So now let us come to the second type of diabetes, which is type 1 diabetes. It is also otherwise known as insulin-dependent diabetes mellitus. So if you remember, type 2 was non-insulin dependent and type 1 is insulin dependent. Often it starts off right in the childhood and hence it's also known as juvenile or childhood onset. And it is caused due to the deficient insulin production in the body and hence it requires daily administration of insulin.
So moving on to the third type. Now, third type is also called gestational diabetes. It arises during pregnancy and is associated with increased blood sugar level, which is above normal, but below those who are diagnosed with diabetes. Generally, it is diagnosed by your gynecologist.
Gestational diabetes also poses an increased risk of complications during pregnancy and at delivery.
Here, Krish, I would like to make an observation that these women and children are also probably at a higher risk of developing type 2 diabetes later in their lives.
So other than these three major types, we have some other types of diabetes as well. More like diabetes related conditions. The first is impaired glucose tolerance, that is IGT, and the second is impaired fasting glycemia, that is IFG. Both of these are intermediate conditions between diabetic and non-diabetic people who are at a higher risk of progressing gradually towards type 2 diabetes.
You're listening to Therachronicles with Dr. Rosy and Dr. Krish. This health awareness series is brought to you by Therachron, tailoring therapy.
So reiterating what we had mentioned earlier, diabetes has multi-organ system involvement. It commonly affects the heart, blood vessels, eyes, kidneys and nerves.
Adults who are known diabetics have increased risk of heart attack and strokes. What happens is there is reduced blood flow and nerve damage, and this in turn causes the probability of developing foot ulcers and in severe cases may even lead to amputation of the leg.
So moving on to how diabetes affects your vision. Here is an alarming fact which I would like to share for our listeners. Diabetic retinopathy is one of the leading causes of blindness around the world. It is caused due to long-term accumulated damage to the small blood vessels in your retina.
Now, since we have discussed the causes and the disease itself, let's move on to the tests that may help detect diabetes mellitus. Fasting plasma blood glucose, that is in simple terms amount of glucose in your body without any meal. It is a test that is used in detection of diabetes. Raised plasma glucose levels up to 126 milligrams per deciliter confirms the presence of diabetes.
So this brings us to the fact that early diagnosis can be accomplished, and that too through relatively inexpensive testing of blood sugar. Now, controlling blood sugar is important. Now, how can you control your blood sugar? Primarily with dietary modification, physical activity, adequate lowering of other known risk factors which are known to damage blood vessels.
We can very well achieve adequate control of diabetes with some easy and cheap interventions, such as controlling your blood glucose, blood pressure, and blood lipid. Along with this, what is important is taking proper foot care, proper screening and treatment for, say, retinal damage, nerve damage, and renal damage.
Now, Krish, I have noticed that some simple lifestyle measures can go a long way to prevent or at least delay the onset of type 2 diabetes. Like, say, achieving and maintaining a healthy body weight, indulging in physical activity, lifestyle modification, And daily exercises, yes, this can be extremely effective.
Along with this, it's important to maintain a healthy balanced diet, which is rich in whole grains and fibers. Consumption of good fats is important, which is found in nuts, vegetable oils, and fish. It is also a crucial step towards getting improved immunity and overall health. Also, avoiding excessive sugar, saturated fats, and use of tobacco and alcohol is very essential for better health.
So, this was diabetes in a nutshell for you. And to find out what exactly diabetes does to your body, watch out for the next episode of Therachronicles, where we will talk with Dr. Avishkar. He's 30 and he's diabetic, where he will take you through his journey of being on the other side of the table.
Thank you for tuning into this episode of Therachronicles. Found it useful? Like, comment, and share it with your friends and family. To keep yourself updated with our latest episodes, subscribe to our channel and press the bell icon. We would love to hear from you at therachroniclespodcast@gmail.com.